The 2025 Henry M. Stratton Medal for Basic Research is presented to Dr. Karina Yazdanbakhsh of New York Blood Center Enterprises. She is being honored for her outstanding research in transfusion medicine, which has led to advances in the understanding and treatment of several classical or non-malignant blood disorders. Her research explores the interplay of the immune system with platelets or red blood cells in blood disorders, including in the context of transfusions, where they can lead to immune-mediated complications. Dr. Yazdanbakhsh's research into the patterns of immune dysregulation, which increases susceptibility to illness, infection, and inflammation in patients living with sickle cell disease, is providing the foundation for more targeted, effective therapies while informing strategies to mitigate immunologic adverse responses to blood and products and improve their transfusion management. Her contributions to the field extend beyond scientific research. Dr. Yazdanbakhsh also serves as a dedicated advocate, leader, and mentor. Congratulations to Dr. Yazdanbakhsh.
Humbled and honored for receiving this prize from ASH. I'm especially thrilled that I'm being recognized for my work, which sits firmly in basic research in transfusion medicine. First and foremost, I am incredibly grateful to my lab and my close collaborations at the New York Blood Center. Shu Liang, Cheryl Lobo, Hui Zhang, Yunfeng Liu, Weili Bao, and Patricia Shi, to name a few, whose contributions have made it possible for me to stand here today. Lesson number one for those of you starting out in research: find talented, supportive colleagues who share your passion and make it fun to come to work every day, as these individuals have done for me. I'm privileged to be in the transfusion field of hematology. Over 40,000 blood components are used by patients daily in the US alone, and yet we don't fully understand how they work at the molecular and cellular levels. This information can help us to improve transfusion safety, efficacy, and effectiveness. I've been fascinated to understand how these components intersect with the patient's underlying disease, studying on one hand why patients develop autoantibodies against their own red cells or platelets, but no other blood components, even in the absence of transfusions, as we see in immune cytopenias. How is it that transfusions can be life-saving for complications such as stroke or acute chest syndrome or recurrent pain in patients with sickle cell disease? And what is so specific about the sickle cell pathophysiology that results in some patients developing these life-threatening, non-infectious transfusion reactions? I have had the privilege of learning from the very best in our field, too many to name, but I want to especially thank Les Silberstein, who has been a major proponent of basic transfusion medicine. Strong leadership that's supportive of basic research, especially at your institution, is absolutely critical. I'm grateful to Mohan Nala, who has been there for me, for his support over the years, and to Chris Hillier, our president at the New York Blood Center, for his leadership. Of course, it's without a doubt that we need funding support, and in this country from the NIH, and I'm grateful to the thankless job of those at NHLBI who are advocating for research every day. Thank you, guys. I want to also thank ASH for their support, and Dr. Alvarez, especially during the past year, for supporting ASH's funding, for supporting research, and highlighting the importance of NIH. Last but not least, I want to thank my family, my parents, my siblings, my husband, Dan, and my son, Marcus. Thank you, Ash, for this honor.